My name is Manal M Younus, and I'm the director of the Iraq Pharmacovigilance Center and active in many international society that promote safe use of medicines across the world. So I would like to take you into a different aspects of hypertension today, related to our work in pharmacovigilance and to the safety of medicines and vaccine, and what are we doing in order to find such kind of relationships between associations between the medicines and the adverse events. So, hypertension related to COVID-19 vaccine, is it a real signal, and what is signal? Before going into that, this is my disclaimer, I have nothing to declare, and I would like to introduce you today to the concept of signal detection through one example, one study related to the hypertension associated with COVID-19 vaccines. So WHO state that, or define a signal as reported information. So you should report information to the center in order to work on it with a possible causal relationship. So there is a possibility between a causal relationship between the medicine or the vaccine and the adverse event, with being unknown, so it was unknown or incompletely known previously. Also, when we say signal, it is more than one report is needed so that we can analyze the reports and we can generate information, the signal. So more than one report is required in order to generate a signal, depending on the seriousness of the event and on the quality of the information. So as much as you put good information on the report, we will give you much more good results of analyzing these data. Another thing is that a signal is hypothesis. So we are hypothesizing that this adverse event is related to this vaccine or to this medicine. Together with its supporting data and arguments, a signal is not only uncertain, but also preliminary in nature. So it is preliminary in nature, okay? This is important to know. And of course, it will change, the situation will be changed as the new information will be advised. So a signal is also provide further documentation on different aspects related to the medicine. So this is what we are doing in the center and across the whole world. In all pharmacovigilance centers, we receive data, we analyze data, and we generate signals and new information related to medicines, and we take actions either as risk management or changing in the information related to the medicines or vaccines. Back to our case. So this is the case. COVID-19 vaccines saves lots of lives across the world, but at the same time, higher risk patients at higher risk need to be studied and to know more about them through the active surveillance. The activities of the surveillance. More than exactly 22 different vaccines brands have been distributed and used across the world, and more than around 4 billion doses have been, people have been used or vaccinated across the years. So at the same time, this is the advantages. The other part, the disadvantages of the vaccines was sent to a global database for the adverse event called the VIGI-base, and around 1.5 million reports have been accumulated in the database. And this is on one hand. On the other hand, the CDC, the US CDC, specifically says that people at high risk should be vaccinated, including hypertensive patients. So this is the idea. We should vaccinate people with hypertension, but on the other hand, COVID-19 vaccine may cause or may exacerbate hypertension. So how do we know that this is the cause of the vaccine and not the other way around? So the methodology used for this research was in two parts. The first part was measuring the disproportionality analysis through measuring the report odd ratios of the reports accumulated in the international database called the VIGI-base. And when the ROR 0.25 exceeds 1, this means that there is a relationship or an association between the vaccine and the hypertension. and review on the, this is one part. The other part was reviewing the medical literature in the Medline, and the search criteria was the same as above, using the COVID-19 vaccine, hypertension also. The result shows that, of course, there is certain terminologies that when we enter the data into the database called the MEDRA terminology, and the result for that, whether it was hypertension crisis or blood pressure increase or hypertension, the RRR showed an increase. So there is an association. It means there is an association between the COVID-19 vaccines and the hypertension. Female was most widely affected, and most of the reports were non-serious. Okay, what else? For the medical literature review, it showed that the percentage of patients with abnormal hypertension with a significant increase in hypertension after receiving the COVID-19 vaccines were up to 23% of these patients. I mean, the reported information to the database. Also, vaccine, Pfizer vaccine called the Comirnaty was the vaccine most frequently involved of reports with hypertension, and almost 2/3 of the patients with elevated blood pressure after the first dose also relapsed after the second dose. So they have been relapsed after the first dose. 2/3 of them also relapsed after the second dose. The events have been described in it was not serious. It means it is a short-term increase in hypertension, specifically observed with elderly female patients with risk factors. The postulated mechanism is that there is a down-regulation of ACE2 receptors and imbalance between the angiotensin 2 and angiotensin 1 to 7 that might describe the rise in blood pressure following the COVID-19 vaccines. To conclude, how much time do I have, Dictora? Oh, okay. Thank you so much. So, result confirmed that a signal of risk. So it is a signal. So it is preliminary information related to elevated blood pressure and immunization of COVID-19 vaccines in general population. There is a signal. There is a new information that we need to work further on it. This is one. And there is no evidence that the episodes could result in chronic hypertension or in serious complication, typically associated with hypertension, such as stroke, aneurysm, إلى آخره. And there is no evidence that COVID-19 vaccines can endanger the positive risk balance. So we are saying that, but we are not saying that the vaccines should not be used. The vaccines should be used, and they are still effective, and they are still have benefits for all of the patients. We are saying that there is a risk, and we need to take care of that risk, and we need to know how to deal with this kind of risk. And so this should be reflected in the different guidelines for treatment of hypertension during when administering COVID-19 vaccines. So I will say again, further information, further studies are needed in this kind of signal. This is, I will end my presentation at this part, but also I would like to say a few words about our work in the Iraqi Pharmacovigilance Center at the Ministry of Health. We have 72 reports related to hypertension during COVID-19 vaccination. Most of these reports were non-serious also, and most of them were related to male, not female. So there is a differences. But of course, when we talk about the international database, there is 1.5 million. So that we will depend on the international picture more than to the local picture. One of the reasons of this low, 72 reports, I think that we need to send more reports to the center so that we would know the picture more clearly in Iraq and what is happening in Iraq. So this is my my final message to you. Please report any kind of adverse event that you would incorporate during your work to the Pharmacovigilance Center, and we will work with the same methodology that we have shown you. We will find the disproportionality analysis, we will generate signal, we will share with you the signal. So this is the outcome of our work, will benefit you and benefit your patients. And with that, I would like to thank you again. Thank you so much.
Thank